Hi, this is Dr. Clay Molliver. Welcome to my vlog, Liposuction. You'll hear vaser-assisted, smart lipo, sculpting, cool lipo, all this stuff. All of the current literature shows that at 3 and 6 months, they're all the same to traditional liposuction, done with the tumescent technique, and most of them, you still have to inject the fluid into the tissues. We do it under general anesthesia here in our fully accredited surgery center. So who's a candidate for liposuction? Well, unfortunately, in many plastic surgeons' offices, if you've got money, you're a candidate. I don't do it that way. I think the better candidate, and the way it was originally intended to be, was for someone who has areas that are resistant to diet and exercise. The hips, the lower tummy, the inner outer thighs, the tall, slender lady, or the slender lady who has the fullness on the outer thighs, so-called saddlebag deformity. This is where liposuction was originally intended to be done. If you're globally overweight, if you have a BMI, a body mass index, over 32, 34, 35, you really shouldn't get liposuction. You should get diet and exercise and get things reduced and then consider what you need to be done, what needs to be done, a breast lift, a tummy tuck, etc. When we look at someone to see if they're a candidate for liposuction, we have to look at the quality of the skin. Imagine I have 2 couches in my living room. One couch is covered with spandex, the other couch is covered with linen, sort of like the jacket I'm wearing. My wife says to me, "Clay, these couches are overstuffed. They're 270-ish looking. Take them out to your shop, get your son to help you, put them up on the bench and take the batting out of them." Like a good husband that's been married for 32 years, I say the last 2 words in any discussion, "Yes, dear." So I take them outside, we put them up on the bench, we take the batting out, we bring them back, we put them in the living room. My wife says, "Well, you did a great job on that couch, not so good on that couch." What's the difference? The spandex couch has elastic skin. The envelope shrinks back, so it stays smooth. Even if we weren't perfect in our taking our batting out, that elastic covering snaps back. That's young skin. That's going to snap back. It's very forgiving, and it gives you a nice contour. 50-year-old, 55-year-old, or someone with a lot of stretch marks, damaged skin, they have skin that's like linen. It has no elasticity. So when the batting comes out of it, it just kind of folds irregularly, and you get folds and divots and waviness. And in some people, they don't care, as long as they look better in their clothes. And as long as we understand that ahead of time, I'm perfectly willing and able to do liposuction on that person. It's all about expectations. If you're expecting a nice, tight, smooth contour to your skin, and you've got very damaged skin by having baby and stretch marks, or having older skin that doesn't have elasticity, and that happens at around 45 to 50, don't be surprised if you have waviness afterwards. But in some cases, that'll be okay. Another place liposuction really is, I think, indicated is in some people, and oftentimes it's women, that have a pear shape. They're petite up top, they're petite in their waist, and their bottom and their thighs just really expand. And it's unfortunate. These women will tell you they lose 5 pounds and their breasts disappear. So for these women, I think liposuction is wonderful. We can contour their thighs and contour their buttocks and really bring that volume down and get them in balance again. If they're really overweight, we'd like to have them lose weight first, but that's a good place. The other place that liposuction is turning out to be really good is in some young women where we do a breast reduction with liposuction. Not all, but some. And I have a case like that on my website. No scars, just a couple little puncture marks, which, by the way, is how we do liposuction, with tiny little puncture marks that are very inconspicuous. But we can actually liposuction breasts and get the tissue to shrink down and do a breast reduction without incisions. That's pretty cool. Thanks for visiting my vlog. This has been Dr. Clayton Molliver. If you want to explore plastic surgery, please give us a call at 281-282-9555. You can Skype video conference with me at Doc Molliver, or you can reach us on the web at drmolliver.com.